fiscal year 2024, there were 979 whistleblower cases, an all-time high. On June 30th, 2025, the Department of Justice, the DOJ, announced the National Healthcare Fraud Takedown. Essentially, 324 defendants were charged relating to $14.6 billion in alleged fraud. On July 2nd, 2025, that's just 3 days later, the DOJ and HHS launched something big, something strategic. If you're in the life sciences, you better believe your name's on it. It's called the False Claims Act Working Group. It's a cross-agency task force focused on steady and aggressive enforcement of the False Claims Act. And the places they're targeting? Clinical trials, promotional claims, kickbacks, sloppy documentation, you name it, and we know they're going to be targeting it. As you can tell, this is a pattern, and it affects regulatory lawyers, compliance officers, corporate lawyers, clinical research site owners, pharmacy owners, and pharma advertising managers. So what is this working group? It's a new coordinated enforcement body that's trying to eliminate loopholes. They're trying to coordinate oversight and increase pressure. We just had the big, beautiful bill come out. The DOJ has got prosecutorial muscle. HHS is bringing investigational tools and healthcare-specific oversight. The DOJ already warned that they are targeting healthcare fraud. Together, this two-headed heat-seeking missile, it's pointed straight at non-compliant life sciences operations. And that includes you, healthcare practitioners. That includes you doctors, that includes you pharmacists, that includes you pharma companies, that includes you medical device companies. And if you're in private equity, obviously that includes you too. Let's start with clinical research. The working group is prioritizing fraud in trials, especially around consent forms, fabricated data, improper enrollment, and mismanagement. Think about the AMB research conviction. That wasn't that long ago. I think that was 2023. And that wasn't a one-off because there have been several more since then. If you are a clinical research site owner, your audit trails, your monitoring plans, your enrollment documentation all needs to be bulletproof. You're exposed if your consent forms are outdated or inconsistently signed. Look at your delegation logs. Make sure everything is appropriate. If you're a corporate lawyer working in M&A, obviously this matters. Whether you're acquiring a site, a CRO, a small biotech company, without doing the proper due diligence, this is going to be sloppy, this is going to be negligent, and you don't want your deal to carry a False Claims Act risk baked into it. As you may know, you may have a 6-month window to disclose any problems you find to avoid success or liability. Now let's talk about promotions. As you know, too many people think that the FDA is the only cop on the beat. Not anymore. Misleading promotional claims, off-label suggestions, improper speaking arrangements, and disguised kickbacks, they're all front-door False Claims Act liabilities. The DOJ and the FTC are both watching. They're looking at your sales aids. They're looking at what your speakers are saying. They're looking at what your salespeople are saying. They're both looking, asking, and ready to penalize you. These are real risks, especially if your value transfer looks suspicious or the language is not aligned with the package insert. Remember, we've now moved away from off-label speech to intended use. And what does this mean for you? Next up, pharmacy owners. Are you a pharmacy owner? Because you may think you're out of the line of fire, but you're not. If the pharmacy is working with prescribers to fill compounded meds without proper clinical rationale, or engaging in patient steering, or questionable reimbursements, this task force will come for you too. Again, if you look at the 2024 cases, or even the June 30, 2025 takedown, specialty pharmacies and marketing firms are getting caught in this kickback net. Dispensing and distribution are very much something that the DOJ is looking at. So what can you do? Start by auditing your operations with this working group in mind. If you're a research site owner, look at your consent tracking, look at your delegation logs, look at your protocol deviations, and are your SOPs for monitoring and AE reporting compliant? Are you doing those exact steps as identified in your SOPs? If you're an advertising manager, reevaluate your speaker contracts, look at your claims, are they adequately substantiated? And ensure that your MLR teams are not just rubber stamps. And that includes your privacy teams. Remember, promotional compliance is different from privacy compliance, and those elements do interact. If you're a pharmacy owner, take a hard look at your relationship with marketers, prescribers, and your claims logic for reimbursement products. If you're a corporate M&A lawyer, Ask about False Claims Act exposure before you sign. Do your targets have unresolved OIG audits? Any prior enforcement letters? Any overstated clinical data? Just dig deeper. But let's say you find something, now what? Well, now's the time to fix it, but you do need to consider if you will voluntarily self-disclose. Say you catch a problem early, a bad promotional slide, a protocol deviation, speakers who went rogue, and you disclose it. Maybe you can actually earn some credit, maybe even reduce penalties. The DOJ has come out and said that they are looking at this favorably right now. But if your disclosure is partial, if it's vague, if it's reactive instead of proactive, you've just handed the DOJ and HHS a roadmap to expand their investigation. Hopefully you're enjoying these KLF deep dives, because this is exactly the type of regulatory headwind we want to talk about, where law, ethics, and commerce collide. Subscribe if you want some more real-world, no-spin insights on FDA-regulated industries. At the Kulkarni Law Firm, we're helping clients across research, promotional teams, pharmacies, and investors to spot these FCA pressure points and to help patch the gaps. Call, click, or email